Hi, everyone, and welcome. I'm going to just give us a few minutes to let folks sign on, and then we'll get started. Always try to keep to the agenda on webinars because we want to respect your time. All right, I think I'm going to go ahead and get started. We were talking as a group of organizers earlier, kind of joking about the fact that nowadays there are so many different platforms for video meetings with our work lives and our home lives as parents. So GoToWebinar feels kind of like a novelty at this point, since so many of us are used to Google and Zoom right now. But I wanted to introduce myself. I know many or most of you. My name is Vanessa Thompson. I'm the Fellowship Director for the Champion Provider Fellowship. Also, as you all know, I'm primary care physician based here at San Francisco General Hospital. Really thrilled that so many folks can take time out of their day to join us to talk about such an important issue right now. Although folks aren't necessarily going to school, I think putting ourselves and our communities in a position to develop safe routes to schools is really important. So just a couple of points of from kind of an administrative perspective. Make sure to check your audio. If you can hear us, can you write yes in the chat box? So if you can hear me, write yes in the chat box.
And it looks like we're good.
We're good. Thanks,
yeah.
Alana. So what we're going to do today, just to keep the webinar moving forward, is that we're going to keep everyone muted throughout the course of the presentation. If you have questions, and we hope you do, during the presentation, please go ahead and use the chat box to write your questions. We'll be monitoring your questions, and we'll definitely have some time for questions and answers at the end of the presentation. If at any point during the webinar you're having technical difficulties, you can go ahead and contact Alana Pfeffinger, who is the event organizer. But before we get into today's presentation, I wanted to highlight a few additional Champion Provider Fellowship events. I think many of you have received invitations and reminders about our mini college, which is scheduled for Thursday, September 17th from 9 to 3. Of course, that will all be via Zoom, and we're really grateful to many of you who have already signed up. But to entice those of you who have not yet signed up, program highlights include an introduction to persuasive narrative by Mike Miller and Paula Hamilton of Brown Miller Communications. We're going to have a keynote address by Dr. Alice Chen, who's currently the Deputy Secretary for Policy and Planning at the California Health and Human Services Agency. She is a former UCSF faculty member and is actually one of the main people who taught me how to be a primary care provider. We're also going to have a policy landscape discussion with representatives from the California Medical Association and the California Dental Association, as well as works in progress presentations from fellows from San Francisco, Monterey, and Imperial counties. So we're really excited about this. We have built-in breaks because we know that Zoom learning can be tiring, but we're hoping that you all can join. So for today's webinar, we will explore an intervention to increase access to physical activity via Safe Routes to Schools program. Shortly, we're going to hear from our presenter, Lloyd Nadal, who is the Program Services Division Manager of the Solano Transportation Authority. I was just learning more about him, and over the span of his career, Lloyd has been involved in and passionate about working to support programs that can influence the health and lives of people and communities. A career mostly in public health, policy, and community youth engagement has been his prior focus to his current role as the Program Services Division Manager for the Solano Transportation Authority, as I mentioned. In his current role, Lloyd manages various mobility programs, including the countywide Safe Routes to School program and the Mobility Call Center. Lloyd serves as the chair of the Human Relations Commission for the City of Vallejo and Measure 5 Citizens Oversight Committee for the Vallejo City Unified School District. He's also on the board of directors for the Asian Pacific Islander American Public Affairs for Solano County chapter, and a former steering committee member for the Office of Health Equity and the California Department of Public Health. So we're really thrilled that Lloyd was willing to join us today and share what he has learned over a long career in public health. Our learning objectives for today, as hopefully as you will hear, include understanding the benefits of safe routes to schools and the realities and challenges of the program today, especially as it relates to the COVID and post-COVID environment. Also, to explore how Solano Transportation Authority and the SR25 program are addressing equity from a systems level, and then also exploring how Solano's Safe Routes to Schools program developed an infrastructure for continued community buy-in and success. So I'm really grateful to hand it over to Lloyd, who is going to take us through some important information about what's going on in Solano. Thanks so much.
Great, thank you, Dr. Thompson, and also Ilana for having me here today. It's really a pleasure to speak with you all. And I'm really, I know how busy everyone is, and so and there's a lot going on in the world right now, so I just wanted to pause at that and just, thank you all for taking the time to listen to this webinar today. If anything, I hope, today is a bit of a pause, and, with a lot what's happening, especially as I understand, you all as physicians, whether you're on the front lines or just dealing with patients or your families, or your kids, just hopefully this is something not stressful, but just something to think about in terms of, what we're doing here with the Safe Routes program. So before I jump into Safe Routes, I actually was on the website for the Champion Provider Fellowship, and I was really impressed and want to commend you all for the work that you're doing to be within the communities that you're working in, and sort of outside of the clinical setting, and really trying to engage in the community. I think that's been one of the successes, I think, of this program, not just in Solano, but I think across the country, is the involvement of folks that maybe traditionally aren't involved in government. And so having, physicians and having community members engage and provide their expertise, I think, is the key, one of the key strategies, I think, that I'll discuss sort of in my presentation. So next slide, please, Alana. So just some background, I think, for those that are familiar with Safe Routes, this information is pretty handily available. But back in 1969, there's about half of the students or half of the kids or young people in the country walked or biked, and about 41% actually lived within a mile of the school. And so if you lived near the school, most likely you were going to walk. Next slide, please. And fast forward 40 years later, and that number goes from 50% to 13%. 13% is actually the national average now today. And there's less and less people that live near schools for a variety of reasons. But that's also decreased the amount of people that just walk. So if you live closer to a school, less and less people are actually walking Again, I'll discuss what, in terms of how our communities are planned, how that's been decreasing people's ability to walk as well. Next slide. And then, so because of these issues, there's been a lot of movement of creating safe routes to school programs across the country. And so I'll talk a little bit about Solano, but a lot of programs started to begin to form in the 70s and the 80s, and even a national safe routes partnership. As you'll see the slide here, the national partnership provides policy support and programs for the safe routes program. And there's immense benefits that I think many of you may or may not be familiar with, that this flyer that's on the slide, you can definitely see. One of the most notable ones that I think in terms of promoting physical activity and the connection to academic performance. Obviously, it's better for air quality when you're walking and biking rather than being in a car. And then even the safety aspect, having a community that's safe around the schools, I think is important as well. Next slide. So in Solano, we've